What is a p-value? Medical research results often include a p-value. Researchers usually use a cutoff value of 0.05 to determine whether the p-value is larger or smaller. But what is such a p-value actually? We explain this using a study on the effect of a blood pressure lowering drug, where the blood pressure of people with a blood pressure lowering drug is compared to the blood pressure of a group of people who receive a placebo. The calculation and interpretation of the p-value is based on the theoretical situation that there is no effect of the drug, so that the average blood pressure in the two groups is the same. This position is called the null hypothesis. Even if our starting point is true, so even if the effect of the blood pressure reducer and the placebo is the same, the difference in blood pressure in the two groups will not be exactly zero. By chance, it can be slightly larger or slightly smaller. Now suppose that the research shows that blood pressure in the group with an antihypertensive is 5 mm lower than the placebo group. The p-value is the chance that we find a difference of 5 mm or even larger if our starting point is correct. Suppose the p-value in our study is 0.003. That means that if there is indeed no difference in the average blood pressure between the two groups, there is a chance of 0.003 to 0.004. They still find a difference of 5 mm or more. Now we can do two things. Or we accept that the chance of finding this effect is small, but it could mean that we find a difference of 5 mm, while there is actually no difference. We may question our starting point. There is a difference in blood pressure between the two groups. The smaller the p-value, the stronger the evidence that the starting point, there is no difference, is incorrect. Researchers often choose a cutoff point of 0.05. If the p-value is less than 0.05, they reject the hypothesis that there is no difference. And if the p-value is greater than 0.05, they do not reject the starting point. The danger of such a cutoff value is that a p-value of 0.049 or a p-value of 0.04 is, or 0.051 leads to totally different conclusions. But the p-value is not so black and white. The certainty or uncertainty about the extent of the effect of, for example, a blood pressure lowering drug can therefore be better captured in a confidence interval.